Testosterone replacement therapy, what you need to know. Hypogonadism in men is a clinical syndrome that's from the failure of the testicles to produce adequate levels of testosterone and a normal number of spermatozoa due to a disruption of one or more parts of the hypothalamic pituitary testicular axis. Testosterone production and secretion is regulated by the hypothalamic pituitary gonadal axis. This axis involves a number of different hormones in the body. It involves the hypothalamus, the pituitary gland, and the testicle. GnRH is secreted from the hypothalamus and stimulates the anterior pituitary. The anterior pituitary then sends signal in the form of luteinizing hormone and follicle-stimulating hormone to the testicles to tell the testicles to make either testosterone or sperm. There's a negative feedback loop to the level of the pituitary and the hypothalamus. This negative feedback loop keeps the signal and the production of hormone in check. Let's review the symptoms associated with male hypogonadism. Low testosterone can cause psychological effects with a depressed mood. It can cause physical effects with loss of energy, fatigue, and osteoporosis, and sexual effects such as a decreased sexual desire and erectile dysfunction. Low testosterone or hypogonadism is very common, with 39% of men over the age of 45 having hypogonadism. To diagnose hypogonadism, your physician will take a detailed history and perform a physical exam and do hormonal testing, especially with 2 first morning testosterone levels drawn. Other hormone levels such as LH, luteinizing hormone, and follicle-stimulating hormone or FSH will be obtained to determine if the patient has secondary hypogonadism or primary hypogonadism. After obtaining these tests, your doctor will go over these results and discuss options with you. The decision to treat is based on several variables: patient age, the type and severity that the patient's symptoms are, the cost of medication, whether you're a fertile age and want children or are done having children, as well as the risk of heart attack and stroke. The advantages of testosterone replacement are many. Testosterone replacement can improve libido, erections, and energy level. It can decrease body fat and increase muscle mass. It can help prevent osteoporosis, help with mild anemia, improve memory, and decrease cardiovascular risk. But there are also risks with testosterone replacement. It can worsen edema or fluid retention. It can make sleep apnea worse. It could cause polycythemia. It can cause worsening lower urinary tract symptoms when a patient has BPH or enlarged prostate. It can worsen prostate cancer or breast cancer. It could change thyroid values and lipid values. It can cause local skin reactions when it's used topically. And there are other studies that say that it could cause a higher risk of heart attack and stroke. There are many different types of testosterone replacement therapy to consider. Topical gels such as Androderm, Testim, Fortesta, and Axe Iron, as well as generics. Intranasal gels like Natesto. Buccal therapy like Striant. Implantable pellets like Testopel, or intramuscular injections such as short-acting testosterone enanthate, testosterone cypionate, or long-acting injections like Aved. Oral agents are not used generally because of the risk of liver dysfunction and liver cancer. Topical testosterone replacement therapies are very common, and there are a variety of different brands available. They all have unique application sites, as well as different metered dose pumps or packets, different starting doses, and daily application volumes. Your physician will discuss with you which is best, as well as balance cost and insurance coverage. There are advantages and disadvantages to topical therapy. The advantages are there are no needles, it is quick acting, and you are able to achieve steady state testosterone from the daily application. It's convenient, and these therapies travel well. The disadvantages are that you can have a variable absorption based upon individual skin properties. Some patients report rash or itching. You have to be careful not to transfer the gel when wet to others, like children or female partners. You have to use the therapy daily to achieve good levels. The treatment can be messy. Sometimes they're not well covered by insurance and may be expensive. Another therapy to consider is injection therapy. And again, there are advantages and disadvantages to this therapy. The advantages are that sometimes injections can last anywhere from 2 weeks to the long-acting of 10 weeks. The treatment levels achieved are very reliable once they're titrated, and there's no risk of transference to others. The disadvantage is that a needle injection is required. Some patients develop an allergy to the medication. When used short-acting, you can experience relatively quick mood swings. And long-acting dosing, you have to be watched in a medical environment for pulmonary oil microembolism for 30 minutes following injection. Implantable pellet therapy like Topical, there are a number of advantages. It has a long duration of activity, achieves good reliable levels, no daily application, and no risk of transference. You virtually get the medication and then you can forget about it. The disadvantages are that the pellets have to be placed at a doctor's office and it's a minor surgical procedure. The site can get infected and sometimes pellets can extrude and come out. Regardless of which testosterone replacement therapy you choose, there are a number of things that you must be aware of. 1, testosterone should not be used in patients with existing breast cancer or prostate cancer. You should not use testosterone if you have severe edema or water retention. You have to use testosterone with great caution in patients that have existing obstructive sleep apnea. Testosterone should not be used in women who are or may become pregnant or breastfeeding. And patients with recent heart attack or stroke should not use testosterone. Your physician will discuss with you the FDA statement on testosterone that comes in every package of testosterone replacement therapy. Your doctor will determine with you if you have an increased risk of cardiovascular disease and is it safe for you to start on testosterone therapy. So when you're diagnosed with a low testosterone, you do have the option of not treating. You also could consider oral medications or other injection medications to stimulate the pituitary to make more luteinizing hormone. When patients start testosterone replacement therapy, it's important to regularly check labs twice a year. Your doctor will check your testosterone levels, your PSA level, your blood counts, and your lipid profile. Importantly to follow is your clinical response to therapy. Are you feeling better? Is your sex drive better? Are your erections better? Please call your doctor if you ever develop a rash or experiencing profound itchiness while using the topical testosterone. If you develop breast swelling or tenderness, worsening edema, leg swelling, shortness of breath, worsening sleep apnea, feelings of aggressiveness or considerable mood swings, or any chest pain or weakness, please call your doctor or 911. If you decide to proceed with Topical implant or Aved injections, your physician's office will coordinate and schedule this with you. These procedures will occur in your urologist's office. You'll be contacted with a date and instructions of where and when to report. These procedures take about 10 to 15 minutes on average, but every case is different. Please arrive at least 30 minutes prior to the procedure. You will go home that day, and it's always good to have somebody accompany and stay with you. The prior authorization process is essential for some types of testosterone replacement, especially Topical and Aved. We will communicate with your insurance company to determine your coverage and any co-payments or deductibles that you might owe. We will provide you with an estimate of any charges that you may incur. All charges are due prior to the procedure and payment plans can be arranged. There's usually no special preparation for these procedures. If you're getting an implanted testosterone like Topical, you may need to stop aspirin or blood thinners depending upon your physician's instructions. Please remember, never stop these medicines without first consulting your primary care provider. Always bring a list of your current medications with you. If you are receiving an Aved injection, you will need to stay after the procedure for observation for at least 30 minutes. We do hope that your treatment goes well, and we sincerely appreciate your feedback regarding your procedure. We are always trying to improve the care that we provide to our patients. Should you have any questions regarding your procedure or recovery, please contact your doctor. Thank you.